patients with diabetes in Trenton face many different types of barriers. Transportation, getting to medical appointments, getting to the grocery store to buy healthy food. There are also barriers in education and health literacy. Trenton Health Team helps to address some of these barriers by bringing together a continuum of providers across the city that can really work together to coordinate and effectively take care of the people that we're working for and with every day. Dr. Schwartz is a primary care provider, and we're able to refer patients to him, and his clinic provides a really important resource for many patients with diabetes in Trenton.
I'm a physician. I'm an internal medicine physician at Capitol Health, and I'm also project lead for Bridging the Gap program, which is administered by the Trenton Health Team. So a grant like Bridging the Gap allows us to get everybody around the table from different organizations and talk about how we can really change the systems of care. We have social workers, we have nutritionists, we have clinical pharmacists. So our program is really designed to really look at, a 360 approach to a patient.
I am the social worker for the care management team. And the care management team manages clients on the outside of the hospital or outside of the doctor's office. We manage them in the community, in their homes. The social needs not being met is a very stressful situation on the client. The client is more concerned about their basic needs, I think that's instinctive, than they are about checking their blood sugar. In my role, I try to minimize the social issues. In that way, they'll better be able to manage their own health themselves.
Working with social workers in the care management team is monumental in terms of the care that we can deliver. Some of the challenges that a patient faces as they try to deal and cope with diabetes, it's not something that as a physician I always hear. So it allows me to have greater empathy and really see things through the patient's eyes so that we can better understand what the patient's needs are and work with them towards solving those issues.
Trenton Health Team works with a lot of healthcare institutions. The other way we're working is in the environmental context. We're looking at what in Trenton really affects diabetes, and we're working with peer educators to educate patients in their community setting.
My name is Clara Gregory, and I'm the outreach specialist for the faith community here at Trenton Health Team. My role is to go into the community to help people learn more about diabetes.
Through Bridging the Gap, we decided to conduct diabetes listening dinners out in the community. We wanted a way to give patients input into how we develop our program. We thought the best way to do this was to go into community settings and have real conversations with people and share a meal. The first time we did this was at Trinity Cathedral. What we heard is that people were eager to have more support and education kind of in their community setting.
That night, a lot of people who were there didn't really even know some of the signs and symptoms of diabetes. And so the people from Trenton Health Team decided also we need to do something to help people learn more about diabetes.
We listened to that feedback and were able to bring this new program, this peer mentoring program, to a residential housing building in Trenton. And we were actually able to engage the participants from that dinner in designing the program. So this was really a collaborative effort that we engaged in with the residents of Trenton.
Now they feel empowered because they know about diabetes and they know things that they didn't know before.
Through Bridging the Gap, we're able to work with multiple different partners across healthcare and the social sector, and we've really come to understand that the patient at the clinic is the same client at the soup kitchen, at the homeless shelter. We work with people who work in behavioral health, at the homeless shelter, at food pantries, at organizations who conduct healthy homes assessments, kind of the whole gamut of partners in Trenton who work both in the clinical setting and who work outside the clinical setting, really bringing all of these different personnel together to work towards a common goal.
We had such a vision for what it is we wanted to do that we thought this grant opportunity would really be a wonderful forum for us to really implement change in the health and well-being of our community, especially as it relates to diabetes. We would not be able to do that if not for the opportunity through Bridging the Gap.